I want to tell you a little bit about my brave new practice today. It's time to be a trailblazer, a person who makes a new track through wild country, and we're in wild country right now with these new laws, MACRA and MIPS. Be an innovator. And it's time to grab your gumption, not your ankles. Gumption is courage and energy, initiative and resourcefulness. And Bob really touched on our mission. What is your mission? It's to preserve the Hippocratic ethical medicine that's centered on the patient-physician relationship. It's based on trust. This is liberating and innovative. And we must get government out of medicine. Forge an alternate universe that has the option to get rid of single payer is what we don't want, and that's what the government wants. They want socialized medicine. This is based on fear, it's abusive, and stagnant. So we want to save the patients, the practice, and the future of our profession. So basically, I'm an ophthalmologist, a specialist in ophthalmic surgery. And so this has been really interesting because most of my patients are Medicare age. When you get a cataract, you're Medicare age. And fortunately, I have a combination of office and surgical practice for patients of all ages. I've been in practice long enough to have patients from 4 generations. I have paid off most of my equipment. However, ophthalmology is very intensive technology-wise, and I have to keep buying new equipment and staying up to date, and just recently leased a $450,000 laser to incorporate into cataract surgery. Because I believe in innovation. I don't believe in stagnation. I believe in doing what's best for our patients. That's important. Now, technology, it's interesting in ophthalmology, innovation and technology is not covered. Advanced lens implants that correct astigmatism and presbyopia are non-covered services. The laser's a non-covered service. So you have to look at what's really going on. I think it's very important that everyone in this room understands what is going on with every insurance company, every benefit that your patient has. And when the patient comes in, even though I don't take any insurance, I'm out of network for everyone, my staff tells me what their benefits are and what they would have been. So I know what their copay would have been. So I can say, oh, I have a follow-up visit today for your corneal abrasion. It's $45. Your copay would have been $60. You saved $15 not using your insurance seeing me. So you can be creative, and you need to inform your patients, and you need to do it, not your staff. So I know what everybody's deductible is, what their copays, and I can say, wow, this wouldn't have been covered. Seeing me, you're saving X amount. And of course, I do LASIK and refractive surgery, and this is not covered either. So as we discussed earlier, I finished my residency, and when I was on faculty, it was right when the RVUs and quality assurance and all this was coming out, and I was just young and fresh and really wanted to figure this out and help them do it, which was wrong. So then I went into solo practice, and at that time I took out a credit line for $100,000, and I worked office sharing with another practitioner. And eventually, over the next 5 years, I bought the practice from her. And now I office share with a younger associate. So we have 9 full-time FTEs. So if you divide that by 2, I guess I'm responsible for 4.5 FTEs, even though the entire business is under my name. And then she office shares the entire practice. However, how did I get to this point? I'll tell you that it's interesting. The physician that I had before really bought on board to the PQRS and all this. I didn't, and that was interesting to see the way that went. So the first thing I did was I opted out of Medicaid. Then we built our office building with a group of friends and paid that off over 10 years. So that's helped me with my rent, although it doesn't pay all of it, that's for sure. And then we got Obamacare in 2010. And that's when I changed my status to non-participating. And I think that here's a way to look at non-participating. When you're participating, the patient comes in, you bill. You send off, you file, you get a check back. The patient never knows what they paid, what you got paid. There's no skin in the game. When you switch to non-participating, patient has to pay you. They see what you charged them for. They see what you're collecting. Then you bill, and they wait until government sends them a check back. So there's kind of this glimpse of skin in the game when you bill and when they pay. And I think that is an absolutely important transition to make. Dr. Hughes is my colleague in many of the things that we've mentioned, and we both went non-participating just over 6 years ago. And it's all about educating. And then what you need to do, at that time I looked, and 58% of my practice was Medicare. It went to 48% once I changed. And then in 2014, I began to wean off of insurance. I noticed, I thought I'd look, and Aetna had listed me on as an Obamacare in-network provider. I'd never agreed to that. They put me on there without my will. It took me a year to get Aetna to let me off. And when they let me off, they said, well, if I want to get back, I should know that I could renegotiate my rates. That was hilarious. Said, I don't think I'll be back. And then as of October 1st, 2015, I completely opted out of Medicare. And at that point, it had kind of gone down to where I was 41% Medicare. So how do you do this? You've got to understand your practice from income expense standpoint. You need to minimize your expense. You need to understand your payer mix. You need to understand the dynamics of your third-party payers, like what are their co-pays, what are their deductibles, you know, how is this helping or hurting your patients? And you need to understand the healthcare law. This is essential. You got to stay on top of that. When you opt out of Medicaid, remember you can now provide true charity, and that's a wonderful thing. And we talked about a little bit of glimpse in the skin of the game, and I would recommend that everybody immediately go non-par. Absolutely do it. And the names, they love names. Well, non-participating, imagine if a large percentage of physicians went non-participating, then it would have news. Oh, all the physicians are going non-participating. Wow, that sounds horrible. It's really not as horrible as it sounds, but that's what we should do. Right now, the last I checked, only about 4% of physicians taking Medicare are non-par. Out of about 700,000 physicians that take Medicare, only 1% have opted out, but I do believe this is growing. I think when I looked at Ophthalmologist, I was like number 35 out of about 14,000. So then what you do is you get a spreadsheet, put all the codes you do, put every insurer you do across the top. Look at the high, low, the medium, the mean, compare it to Medicare, and then from that, create your own fee schedule. And then drop the lowest and let things re-equilibrate. But you also need to put in there common sense, like what is something worth? So you create your fee schedule, you use what you've been paying, and then you've got to communicate and educate with your patients what you're doing. Then you redetermine what percentage of your revenue and what percent of your patients comes from each payer. Once again, drop the lowest commercial payer. Again, notify your patients. I had lots of letters, and I explained to my patients that I'm not taking them. I'm out of network. I'm helping them. I want to be there for them. It's all how you present it. Pause, re-equilibrate, reassess, and repeat until they're all gone. And I would say drop your last 3 commercial insurance all at once. Just boom, bye. And what you've got to do on the way to this is you need to go over to your surgery center. You know, I do cataract surgery. So as we were saying earlier, that comes under Part B Medicare. So even though I'm opted out, now this is so important. Opted out is also called private contracted. And I love to tell my patients, I'm private contracted with you. You can still use your Part B at the surgery center, and with your anesthesiologist, they're still in it. And then I make my fees reasonable, and I'll show you why they're good. Then you want to look at billing models. I have a hybrid model where you can use your insurance or your Medicare at the surgery center. I don't take any of it. But then I also have a direct patient care model where they can just pay all of it. Because think about this. My surgery center, and I say that, the one I participate at, sends my cataract patients a bill that says $14,000. Medicare pays them about $1,100. I negotiated $1,200, and I'm going to try to negotiate it down again to $1,100. Now, Aetna and all these others have gone over there and negotiated $4,000. So if my patients have a $5,000 deductible, they'll pay $4,000 if they use their insurance. If they use my direct fee, they'll pay $1,200. It's all about knowing what's going on and educating your patients. And that's what you do. Phone call, letters, explain it. I agree with everything. Visit with your family, visit with your banker. I didn't know it was going to happen. I took out a $200,000 line of credit this time, and I fortunately have not had to use a cent of it. Talked to my CPA, and I had a heart-to-heart with my staff. Trimmed, cross-trained. Everybody can do it, and thank goodness we have cheerleading in our family because I do it every day. Saddle up. Welcome to Texas, everyone, but this is a great place to do it, and we are one of the states that now has a direct primary care legislation. I want to change the P to direct patient care to protect us. And opt-out day was 2015, October 1st for me, and I really want all of y'all to do it, and I think you can. Now, one of the things I did on that day was I terminated my outside billing company, and that was sad, and that's an unintended consequence, but they got 7% of my collections off the top. So where am I now? I'm assessing my revenue, my expenses. This is ongoing. It's relentless. And stay on top of the things we talked about and refine your fee schedule. So 7 months post-op. It's funny, on the day I opted out, I was actually in an AAPS meeting. So I was not there for my first day. I came back on the 5th. So this is October 5th through May 5th. And I have 73% of my number of patients. I see 70% of my patient encounters. And I've collected 93.65 of what I collected before. And now I dropped my billing company. So that was 7%. So my net collections are actually 0.065% up. So here we go. That's how that worked out. I'm seeing 30% less patient encounters, and I'm collecting 0.65% more. And we're all the beneficiaries. My patients are. There's true access, quality of care. But what I've got to do is sustain this. How can I sustain this? How can I improve on this? And how can you do it too? I do believe the current system is squandering my potential to care for more patients, because I could be in the OR more, I could be seeing more patients. What a waste. I miss being in the OR at this stage of my career. Now, what happened to my associate and my Medicare? So pre-opt-out, I'd gone down to basically 40% Medicare. Now I'm down to about 30. So I've changed 10%. And then pretty much the same with the percent of encounters. And my income from Medicare changed about 16%. Now my associate before was 35%. She went up to 42. So she got a lot of my Medicare patients, 7.5%. But she's getting a certain percentage. They're a different breed. They're very entitled. They don't want to pay for anything. The ones that stay for me value me, and I value them. So I've got to identify my strengths and weaknesses, as should you of your practice. Why do they stay? Why do they leave? Education. Stay vigilant. Stay abreast of state and federal laws, rules, and engage. The macro rules are impossible. I go to Washington, D.C. to find out what are they up to now, because I want to protect my autonomy, and I want to stay out of trouble. I go to work some days and go, what law am I breaking today? And that's not right. We're just trying to help people. So stay focused. Don't let your feelings and your ego deter you, because I've had days when a patient comes in and they tell me they're leaving, and I almost start to cry. But then the next patient will come in and say, I came to you because of what you're doing. And you protect me and you protect my information. So it all comes out. I don't like not having a big surgery schedule in the OR. There's some ego involved in that, but you got to move beyond that, and you got to improve the model. So I'm going to be a victor and not a victim, say no to burnout and abuse, and we're going to try to create an alternate universe. And I want you to work with colleagues. Let's be the paradigm shift. Let's think outside the box. Let's be the lifeboat. And so basically, these are just my goals. You've got a handout on this. We need to branch out. I wanted to just show you this. My patients will save money not using their insurance, my Medicare patients, if they understand this. If they want laser surgery or if they want a premium lens, they will save, because my fee, if you look at me compared to a guy that's about 5 miles from me, if you look at having laser surgery with a multifocal lens, he balance bills them on top of their Medicare, $3,845. Mine's $2,835 all inclusive. If you look at with the astigmatism lens, it's $2,395. I'm $1,870. And if you look at just sheerly using the laser for astigmatism at surgery, the patient saves $195 to come to me and not use their Medicare. I've got to get the word out on this. Okay, so I would say you've got to look at innovation. I would much rather spend my money on the laser than all of this computer and compliance, which I will not do. I will not disclose my patient's information. I've read this stuff, and they want full bidirectional access to our patient's information, and I will not do it. I need to evaluate how many new patients am I getting. Did they just can't come in to say the long goodbye, or are they staying with me, and am I getting new patients? And I got 266 new patients over the last few months. And I have patients, you would be surprised at my payer mix. They say, oh, you're at a good part of town. Well, guess what? The people that have no insurance drive all the way there to see me. I have people that have no insurance. You wouldn't even begin to imagine my patient diverse mix. And the value is in the relationship versus entitlement. Am I a partner or am I a punching bag? So happy trails, everyone. Stay focused and vigilant. Protect and pursue increasing autonomy. We need to make sure we preserve prescription writing, dispensing, get rid of MOC, protect our licensure, figure out ways to have like a model like Surgery Center of Oklahoma where we can own our surgery centers and develop our contacts. And remember, the future, medical education. I have 2 physician daughters. One's a resident and one's a third-year med student. I've told them, don't take one bit of insurance when you start out. I don't care if you have a shingle and no patients. Of course, they don't listen to me, but that's what I'm telling them. And are we going to be pioneers? Or are we going to be indentured servants? Are we going to fight for liberty? Or are we going to be oppressed? And I agree that just do it. No one else can do what we do, nor will they do it for us. We are the only ones qualified and equipped to do this from one rite of passage to the next. So be a trailblazer and get your gumption. From Webster's, next time I want to see this. It took a lot of gumption for physician trailblazers to resist the insolvent government takeover of medicine and create a viable ethical system that puts the patient first. I really want to thank AAPS. I could not have done this without AAPS and the resources and everyone in this room. From the minute I sent my opt-out letter, which they lost, but Larry had told me to copy it and have a certified letter, just everything you've said happens. So I cannot tell you how important it is to use the resources that are in this amazing group whose motto is all for the patient. And I would encourage you to encourage all your friends to become a member. Here is my information. On my blog, I have examples of my patient letters. And my husband is in business, and he's the one who told me to invest in the building. I said, you're crazy, but I did it. He also told me, thank your patients. When they stay with you, tell them you appreciate them and thank them, because it is a choice, and I do. And I appreciate all of y'all being here today, and I hope everyone will do this.